Dr. Richman is an icon in the area of HIV diseases.
Doug is really, in many ways, the kind of preeminent physician scientist. Doug has been on the scene in HIV research since the beginning. His accomplishments in this regard just run the gamut.
Well, Doug's an amazing person. He's put a lot of effort into everything that he did, including all of us. And as a mentor, as a friend, as a colleague, that was just invaluable to me in many ways.
So I've always had this passion for infectious disease and clinical virology, and I was looking for something that combined exciting basic science with an impact on people and public health. And after I started here at UCSD, I worked on influenza, herpesviruses, and even Ebola. Really in the late 70s, we started seeing these young men with fevers and lymphadenopathy, and I said, this is a virus I have to work with because these are all the patients I'm seeing and there's nobody else doing it.
The AIDS pandemic was quite terrible. All these young people had an incurable and basically uniformly fatal disease. This was a new virus. There were a lot of things to ask questions about, but there was also, especially for people who were in a translational medicine mode like Doug, there was certainly a sense of urgency to try to come up with things to help people.
It was a very stressful and challenging time, and you got the feeling it was like a battleground medicine with one casualty coming in after the other.
Doug has been the linchpin of the HIV efforts. He was part of a group that did a clinical trial with the first antiviral drug that we had, which was called AZT. And it then became clear that the benefits of AZT were short-lived. He then investigated why that was the case and discovered that the viruses that were responsible for the failure of AZT were now resistant.
So Doug did the early studies and called attention like a big red flag that we really got to be careful that when you're dealing with an RNA virus, particularly with antiviral drugs that don't completely suppress all of the virus replication, that you are going to get resistance. The generations of antiviral drugs that started off with one drug that then went to a couple of drugs, and then the ultimate triple combination that broke out and transformed the field in 1996. At every step of that stage, Doug was involved in that clinical trial process. And then he also did some fundamental basic work in understanding the HIV reservoir, which led to a whole series of studies about how one can address it by either suppressing it chronically or hopefully trying to diminish the size of it, and the holy grail of everyone of ultimately eradicating it. And Doug was one of the leading players in understanding the reservoir.
Remember, there were institutions that would not care for these patients, but UCSD did, and Dr. Richman was at the forefront of that care, and over time, he launched our first San Diego Center for AIDS Research, and we are still the beacon of care for patients with HIV.
The San Diego Center for AIDS Research, or CFAR, it seeks to be really a resource locally and internationally for researchers and HIV educators. It really seeks to create collaborations, not just among investigators at our member institutions, but in community organizations.
He also started the HIV Institute to be the think tank and focus on the treatment and cure of HIV. And we at UC San Diego have been a leader.
He had a lot of fellows come to work in his lab from all over, from Australia, from Europe, from Israel. His protege have populated the world of HIV research.
I always kept my door open. I think it's almost 24 people I've counted that are now professors around the world. I really find really gratifying.
Dr. Richman's contributions for the last 48 years have been invaluable. His research, mentorship, and patient care have had a direct impact on building UC San Diego's reputation as a leading global biomedical sciences research institution.
He's also a fantastic clinician. I actually inherited some of his HIV primary care patients at the VA when he retired from clinical service, and they all just love him and speak so highly of him, so it was difficult stepping into those shoes, I must say.
I succeeded because I did what I loved. HIV and AIDS were very challenging things to address, and I feel incredibly fortunate that I've had the opportunity to take care of really great, fascinating patients and make a difference in their lives, and that my research has made changes in terms of treatment globally. There's so much to be done, which is why we need to foster new young investigators in the field.